going to call the subcommittee for House Study Bill 694 to order. With me, I have Representative Baeth and Representative Gehlbach. This is a bill for an act relating to health-related matters, including health-related professions, nutrition, medication, and taxes on certain products, including effective date applicability provisions. With that, I think we have some folks from the governor's office that is your bill. Please present.
Thank you, Mr. Chair and members of the subcommittee. I'm Molly Severn, Legislative Liaison for Governor Reynolds. Appreciate the opportunity to speak today on the governor's proposal. Governor Reynolds has long prioritized policies that improve healthcare for Iowans of all ages and in every community. Her investments have contributed to Iowa's ranking as the top state for healthcare affordability and one of the top 5 states for best healthcare system. Last year, Governor Reynolds proposed and enacted comprehensive rural healthcare legislation. Now, with an infusion of federal funding through the Rural Health Transformation Program, $209 million in year 1 alone, the state will build on its strong foundation by executing its innovative Healthy Hometowns plan to make rural healthcare more accessible, connected, and patient-focused. The governor's legislative proposal includes several pieces. It requires a nutrition-focused continuing medical education, or CME, course for physicians. It requires the continuous implementation of Healthy SNAP and Healthy Summer EBT waivers. It eliminates foods and beverages that contain certain dyes and additives from schools' meal programs and vending machines. It improves access to ivermectin. It increases taxes on cigarettes, vape products, consumable hemp products, and tobacco. It allows psychologists licensed in other states to practice in Iowa. And it eliminates the certificate of need requirement for outpatient behavioral health and other facilities. With me today, I have several staff from HHS, DIAL, the Department of Education, as well as the Department of Revenue. We're happy to answer any questions. Thank you.
All right. I'm going to turn it over to anybody here in the room that wants to come up and speak on this. When you do, please go ahead and fill all the seats around here. We'll go around the room so that way we're not wasting time waiting one-on-one for you guys to come up. I am going to say, and I've had this conversation with the governor's office, my intention is when we bring this bill to committee next week is to have an amendment that would strip out the tobacco, cigarette, vape, and hemp tax. And I believe there's a different House file that's been introduced and has been sent to the Ways and Means Committee for them to have that consideration. So save anybody any time on that, but right.
Hi, everyone. Thank you so much. My name is Paige Chickering. I represent Save the Children Action Network. We're just particularly concerned about Section 16 in this bill having to do with SNAP and Summer EBT. Our preference would be to see that section struck from the bill language, but we do understand that, that might not be the choice of this committee moving forward. And so I'd also like to discuss a couple areas where I think language could be improved if you guys do decide to move forward with the SNAP food restriction waivers as is. So first, I think there's something to be said for what the legislature has in terms of control and kind of governance over the SNAP restriction waivers. Right now, the wording in the bill currently says that SNAP will be administered with a food restriction waiver that specifies that eligible foods are, quote, healthy foods as defined by the director or the director's designee. I think that would essentially strip the legislature of being able to exercise their control over what that SNAP waiver looks like. And so would really encourage you all to consider kind of altering that language so that the legislature itself can continue to legislate what that SNAP waiver looks like moving forward. Secondly, I think there is some confusing and contradictory language in the bill as written as well. So subsection A of section 16 appears to dictate that I will only participate in SNAP if we have a food restriction waiver in place. But then subsection B appears to directly contradict that. So just that it would be really good to kind of clean up that language and ensure that Iowa will be participating in SNAP moving forward, regardless of whether that waiver is in place or not. Understanding that, Washington, D.C. and administrations change there. These waivers weren't always, approved by USDA in the past. And if we see changes at the federal level, we don't want that to mean that Iowa no longer participates in SNAP in the future. As you consider the possibility of striking that section, I'd like to raise a couple other things. First, that under the existing waiver, there will be an evaluation process after 2 years, and then there's the option to, request to extend that waiver for up to 5 years. I think in terms of whether or not you want to codify that waiver, it would be a really smart decision to possibly wait until after we have that evaluation and that data to see whether or not the waiver is actually having the desired effects that we would like to see it have on healthy eating and improving those outcomes. And so waiting until we have that information before making that choice of whether or not we would like to codify that, that would allow you all to make a more informed decision on this issue. I do want to know that we obviously really support healthy, nutritious eating for children and families. That's why we've continually supported Double Up food bucks and things that we see as being really great evidence-based ways to improve nutritious eating. But think that it might be smart to wait until we see kind of the efficacy of this waiver before deciding whether or not we want to continue with that long term. Lastly, and really directly as a result of that point, we have seen grocery prices raise nearly 30% just since 2020. And that was before these waivers were put in place. A recent study from the National Grocers Association also showed that upfront cost for implementing the SNAP restriction waivers are likely to be $1.6 billion across the industry, with annual per year costs estimated at $759.1 billion for each subsequent year. So understanding that while this may not carry a fiscal cost for the state, it is carrying a really large fiscal impact for our grocers and retailers that will be passed along to consumers in the form of higher grocery prices. And in terms of that, maybe why we want to make sure that this has good efficacy and evidence in terms of improving healthy eating before we decide to continue on with that waiver or not. So thank you so much for your time.
Next.
Hi, my name is Tiffany Welch. I'm from Clive. I am a volunteer with Save the Children Action Network, but I'm also here as a parent and as somebody who helps people in my faith community access food. I am asking you to strike Section 16 because the immediate impact of the confusion and the hardship will continue if we turn that into law. So I'm helping families in my congregation access food, as everybody else in here who shops for food knows the prices of food has been going up significantly. And as we try to make budgets work, as we try to make where everybody's different dietary needs comes from that don't necessarily fall under SNAP funds, as we make that whole math equation try to work with families, it's really, really hard on top of multiple jobs, on top of multiple kids, on top of everything else going on. I'm asking that we think of Iowa families and think of other ways like Double Up food bucks, investing in Double Up food bucks, other ways to encourage healthy eating that helps take some of the stress off Iowa families.
Hi, Dustin Miller, representing the grocery industry, and ultimately want to be really brief here. Ours is also about Section 16, but I would actually give you a positive story. We've worked really closely with HHS in implementation of the USDA SNAP waiver, and I would say in our implementation, it has been much easier because of the approach Iowa took in the taxable versus non-taxable. We would actually, that's one of the requests we would have is it makes it much easier from an implementation standpoint. The language currently says healthy, understand the intent. Would love for the requested waiver to look more like what the exact waiver is currently. As was mentioned, this is an annual request to USDA. And ultimately, when you're going through thousands of UPCs, it does make it an easier one. And I would say if you talk to our retailers who are implementing these in other states, we are the enviable position because of that clarity. So we'd love to work with you in the governor's office and HHS on something that provides that clarity from an implementation standpoint. Thank you.
Good afternoon. My name is John Murphy. I'm with the Iowa Beverage Association, and we are registered as opposed to this legislation for a lot of the reasons the first speaker said relative to the healthy foods list. I would only add that, going forward, we don't know who the director is going to be, let alone who the next administration is going to be. And they may very well have a different idea of what healthy foods are. They may think bacon's not healthy. They may think frosted flakes aren't healthy. They may think sugar in and of itself aren't healthy. And so all of those things could be put on this list. And I do read the language the same way, that if the USDA does not approve this waiver list, then we're out of SNAP, which would be obviously a huge mistake. And the bill says we want to have an uninterrupted participation in SNAP. So it goes counter to what I think is the intent of that. I will speak to Division 5 as well, which is the ingredients and dyes portion. And I would just suggest that we have language, pardon me while I get my language, that says that we strike page 6, lines 18 through page 7, line 25, and replace it with school district can only serve a meal to students as part of a school district's breakfast or lunch program that contains ingredients that have undergone a rigorous scientific review and approval process by the Food and Drug Administration. All of the ingredients and dyes on this list have been approved by the FDA. And so there's been rigorous scientific study done on all of these things. And so we don't think that it's appropriate to go through what the FDA has already done and said they got it wrong. So thank you for your time and appreciate the ability to give these comments.
Thank you, Representatives. Luke Elzinga with the DMARC Food Pantry Network and Iowa Hunger Coalition. Both organizations are registered against the bill specifically due to Section 16. We're fully supportive of the summer EBT program, and we're glad to see the governor has followed the evidence and made the right decision for Iowa to participate in 2026, but we continue to oppose food and beverage restrictions for SNAP and summer EBT. Iowa's SNAP waiver has been in effect for 6 weeks, and it has been incredibly confusing and stigmatizing for consumers to navigate. The state has essentially told SNAP participants they need to be an expert in the tax code to know what they can and cannot purchase. And we've seen the unintended consequences of tying Iowa's waiver to our taxable food. Pedialyte is now banned from SNAP. Yogurt-covered raisins are out. Prepackaged sandwiches and salads are banned in certain instances. A fruit cup sold with a spoon attached by the seller is now banned from SNAP. These are just a few ridiculous examples. So now the governor has this bill that would give sole authority to the HHS director or someone they designate to choose what is considered healthy food. And if the USDA doesn't go along with it, this bill threatens to pull the state out of SNAP and summer EBT altogether. This is a blank check signed by anyone who votes yes. Do you, as state legislators, really want to cede this authority to the director of HHS, regardless of who they may be, whether or not they have any formal nutrition education, and what governor they serve? Do you want to set a precedent for other states to act in a similar manner? And I don't know, have California banned CAFO raised pork from SNAP? This section is poorly written, poorly thought out, and completely misses the mark. If we want to make healthy food more accessible for people on SNAP, we need to make it more affordable. These types of restrictions only increase grocery prices for all of us. Iowa's current waiver requires the state to complete an evaluation on health outcomes that has obviously not been completed yet. The fact that our governor is already trying to make this permanent before any sort of evaluation occurs tells me this is not about health, it's not about nutrition, it's just about ideology. I urge you to strike Section 16 of this bill.
Hi, my name is Mark Craig. I appreciate getting this opportunity to speak with you guys. I am here about Section 16 on page 5 as well. I'm a current EBT user, and the way it's worded is a little confusing, and there's too much room for interpretation when it refers to the already confusing waiver. Also, where it mentions giving sole discretion to the director or to one person seems kind of setting a bad precedent. I would like to see maybe a committee with like doctors, pediatricians, real world experience, so we can kind of negate some of the negative impacts that the waivers had. And also, as mentioned, it doesn't put all that power in one person's hand, which could be used nefariously. So I do move to get on page 5, section 16 stricken as the way it's written. It's too vague, and I would hope that we could look in that a little more. And it has good opportunities, but it's kind of vague. Being homeless, I am just now getting into an apartment, and being neurodivergent, I kind of offer that different opinion. I used to be able to go to QT and get a foot long sandwich, and I could take that and eat half the next day, and a yogurt cup and a banana. Now I can't eat that healthy sandwich. I can get a ultra processed McRib that has like 60 different ingredients. But some places that have a microwave, some places that have a place to sit down, I can't. I could buy cookies, cakes, donuts, Kit Kats, a frozen Snickers, but not a Snickers. I can't buy a take and go meal from Hy-Vee because it's by each, not by weight. I can go to Walmart and get a sub that has a mayo and mustard packet, but I can't buy a ham and cheese at Hy-Vee. So to me, this is not attacking obesity. It's not, I'm not obese because I want to eat unhealthy. It's because my options are limited. And I think trying to make this bill permanent, as we can see just in the little bit of time it's going, every retail store is confused. They don't know. Everyone is doing something different. And when I get into a grocery store, I want to get in, get out, because the noise. A 5-minute trip has turned into an hour looking at every ingredient on everything. So I urge you guys to not make this permanent until we get some data. And the major issue is mom and pop stores are probably going to be affected a lot more because they can't take this impact, and we're probably going to have a lot more food deserts. And sorry I spoke a little longer, but I appreciate the time. And I have tons of pictures, emails, and data because I've been working on this since the original bill. And I'm looking forward to working with the people in here, the members of subcommittee and committee going forward to offer a real world experience. Because remember, the average EPT user gets $6 a day to eat on. And right now, that's a fruit cup. So thank you guys. I appreciate it.
Thank you. Teresa.
Good afternoon, representatives. Teresa Harms, here representing a few different clients. So just bear with me as I go through the list and their comments and concerns. But Iowa Farmers Union is still is undecided, looking at the SNAP provisions in the bill, and I'll circle back on those. Des Moines University is still reviewing the language of the psych compact and then the continuing education. And so as I have more and additional information, I'll provide that on those. On behalf of CAFE, which is tobacco control, we appreciate you leaving the tax provisions in House File 2406, and we look forward to addressing those in that bill. Outside of this, as this tax proposal was significantly less than would make an impact to reduce cancer rates in Iowa. And then I wanted to just also talk about the Iowa Hemp Alliance. So removing the tax, thank you, because these products are actually recognized as health and wellness products. But we would encourage you guys to think about including language in this bill to expand consumable hemp products allowed in Iowa by removing the 10 milligram cap on container limits. Those on products other than beverages to help people get access to these health and wellness products. Thank you.
Anybody else? Seeing none, I'll turn it over to my colleagues if they have any comments or questions they'd like to make.
I don't have any comments. I obviously here for Representative Dr. Gendry, and my thoughts are with him and his family, but I don't have any comments.
There are two divisions of this bill that concern me. I'll start with, this is a very serious, bill to help make Iowa healthier, and I'm not sure what ivermectin has to do with it. I think that particular division, which makes ivermectin over the counter kind of reduces the seriousness of this bill because there is no FDA approved reason for ivermectin unless you have parasites. And I think giving the weight of the state government behind that drug to be used over the counter is misguided and is going to hurt a lot of people. And then I'm especially concerned about the division concerning SNAP. And we heard from a bunch of advocates here today whose life's mission is to feed hungry people. And those people today have told us that this provision that would essentially hold our SNAP program captive to whether the feds give us a waiver. It's playing chicken with Washington, D.C. And there's a lot of people who may go hungry if things don't go the right way. I believe this section 16 needs to be taken out of this bill. We need to listen to our folks who are on the ground trying to feed people. Feeding hungry people should never be political. And it appears that the current bill as written has less to do with actually helping people be healthier and have a healthier diet and more to do with creating political talking points. Thank you.
All right. I'm going to recommend passage out of the subcommittee today. We are going to have a large amendment that comes next week to address the tax portion of the bill that we discussed earlier, as well as some other things. And so feel free to reach out. This bill still has some work to be done to it, but we look forward to the conversations, and the subcommittee is adjourned.